Hello, everyone. I'm Greg Nebler. This is Fox 12 Now. We are live streaming here out of the Fox 12 Oregon newsroom. We appreciate everybody who joins us, whether you're watching live or after the fact. We get to have a lot of wide-ranging, longer-form conversations here as part of this show. We do cover, as I mentioned, a wide range of topics, but something that is important is talking about health. And we're going to talk about not only, the effects of going through cancer, something that I think probably a lot of you out there, maybe you've gone through it personally, maybe it's a family, a friend, we've all been affected in some way, shape, or form, but something that we're going to talk about now is the mental health aspects of that and what that really does to that side of things, to go through this and everything involved in it. To do so, we have certainly an expert joining us right now. We have our doctor here, Dr. Christine Barnett, who's going to be joining us here to talk about this. And Dr. Barnett, thank you for having time to join us to cover this. And I think to start off, if you wouldn't mind, could you let everybody know just a little bit about yourself? And obviously, if they can read that, your very important role there with Kaiser Permanente Northwest, but also just some of the work that you do in this field.
Yeah, so I am Dr. Christine Barnett. I am the Chief of Hematology and Medical Oncology here at Kaiser Permanente Cancer Center. I'm also the Medical Director of the Cancer Center. I specialize mostly in hematologic malignancies, so things like leukemias and lymphomas. We're actually pretty subspecialized here at the Cancer Center, and I work with the leaders in radiation oncology and surgical oncology as well to make sure we continue to offer all aspects of care to our patients with cancer.
And so many different aspects of that. I mean, and thank you, number one, for what you do, also for you and your entire team there, for people who are going through this, which can very much be one of the hardest things to go through in life. And to have that kind of support is so important. One thing I know we wanted to focus on here today, in addition to, all of the physical needs that come to that, are the mental health aspects. And could you maybe let us know, what are some of those big impacts that perhaps people just don't necessarily think about when we're talking about cancer, because you think about the physical side, but the mental health being just as important.
Right. Yeah, so there's the emotional and the mental health aspect of dealing with the diagnosis of cancer. So in the moment that you hear that diagnosis, your family members hear that diagnosis, or your loved ones hear that diagnosis, obviously there's a huge emotional toll. But also what we have to remember is that a lot of our patients before the diagnosis of cancer can be dealing with mental health issues, right? Depression, anxiety, other mental health diagnoses, which can play a huge role in how our patients are able to cope and how they're able to tolerate their treatments for their cancer. So we have to come at the mental health toll of cancer in a couple different ways. Impacts on existing mental health issues and also new mental health issues that can come on from the diagnosis of cancer, and not just in our patients, but also in the caregivers, because there's a lot of stress that comes with that. When someone's diagnosed with cancer, it really can become a full-time job. You've become a patient, and that's a big identity shift for a lot of our patients. And so dealing with all of the different aspects that come with that and making sure that we have a lot of knowledge and expertise to treat the mental health aspects of the cancer journey in a very personalized way, just like we do with the cancer treatments themselves. We have specialized treatments for different types of cancers. We need to have specialized focus on different ways that we can help the patients through the emotional and the mental toll that a cancer diagnosis can bring.
And I think so much so, just in what you were just talking about there, the importance of that, but also the caregivers themselves too. It's not something that everybody is going through some of those strains. So when we're talking about the importance of this, what are some of the ways that you can help, address some of these issues, the emotional and the mental sides of this?
Yeah, so we really do have to make sure that we address it, period, because we do know that in a journal Clinical Oncology article that depression, if you have a diagnosis of cancer, you're double the risk of depression from the general population. So we know this is real. And we also know that mental health issues can affect the mortality from cancer. And so whether that be in the ability to adhere to treatments, whether that be in the biology or the stress pathways that get activated. And we do know that if we address those mental health and emotional health aspects of their cancer, that they're dealing with the cancer diagnosis, that we will actually help mitigate that increased mortality risk. So caregivers especially are dealing with something, that very question that you just asked. Well, how can I help? How can I help? And I think an important thing for caregivers to remember is that, you know, the caveat when you get on a plane, right? Make sure you put your oxygen mask on before you help others. So we have to make sure that if we want to help the patient's emotional and mental health, we also have to make sure that we help the emotional and mental health of the caregivers around them.
Such important aspects of that. And, you know, I think when we're talking about making sure that people are aware of that, you know, what do you think is one of the biggest misconceptions that people have, or I mean, we've addressed some of that right here, but just what are the biggest misconceptions that people may have when it comes to this side of things, when it comes to going through cancer?
I think there's so many misconceptions. One of the main thing is that there's a certain way you're supposed to feel when you have cancer, right? Some people have said, I don't feel as bad as I think I should. Is that bad? And then they deal with this worry of maybe I'm not processing this appropriately if I don't feel a certain way. So there is no right or wrong way to feel when you have cancer, and when you're dealing with that. And another misconception is that when you're done with treatment, you're done with your journey. That is sometimes the beginning, especially of the mental health aspects for a lot of our patients. There can be a lot of PTSD issues as a survivor. There can be a lot of grappling with the mental health things that maybe you didn't accept during the treatment because you were powering through with your treatment, and now you're a survivor and you're supposed to be strong. So we want to make sure that not only do we address the mental health and the emotional toll of cancer during treatment, which is really easy for people to see, right? You can see people getting sick, you know, their hair is missing, they're having side effects, but it's a lot harder to see for survivors. And so we want to make sure we have resources to help with the emotional and mental aspects all the way through from diagnosis to survivor.
So yeah, from the beginning to the end, well, or you know, even if it's not the end, but going
Beginning
through
to forever.
beginning forever. Yeah, sorry, that is the best way to look at that. Well, yeah, I mean, just so important in all the work that you do there. I mean, what do you think? I guess, you know, to talk about this, what else do you think is important for people to know about this in general, but also that the work that you do there?
Yeah. So at Kaiser Permanente Cancer Center, we really, you know, we're an integrated system. So we're really able to make sure that we're paying attention to the entire patient, right? What we have to remember is, again, there might be existing mental health or emotional health issues, and cancer is just going to pile on that. Like I said before, being a cancer patient can be a full-time job. And so if you're doing this as a full-time job, how do you deal with all the other aspects of your life, right? And so what we try and do is we try and support the logistics of being a cancer patient as well. That can really help with the mental and emotional burden. For example, what if you have to go through chemo very frequently and now you can't work? What if you have an hourly job and you don't have certain benefits? What if you need caregiving for your kids while you're dealing with this? So we recognize that there's that social and emotional health aspect that can then feed into the mental health of everybody, of you and everybody around you. And so we have things like community health workers that can help with, how do we make sure your electricity bill gets paid while you're on treatment? How do we make sure you're able to get to your treatments? Those things that the stress and anxiety of that piles on to the patient and is kind of in the shadows. We really try and make sure we focus on that. We also try and, like I said before, is like not every patient is going to respond to the same level or intervention for their mental health. So we want to really offer a lot of different treatments or supports for those patients. So we've got support groups, different kinds of support groups for people that really do well with community and with other people. Well, we've also got one-to-one cancer counseling that can be for the patient, for the caregivers. We also have caregiver-specific support groups so that those caregivers who are going through the emotional toll, but also trying to figure out, well, how do I support my loved one? What's the best way to do this? They can be with other caregivers to get those ideas. Kaiser Permanente offers access to apps like Headspace and Calm for free. And we are, Headspace is working with Kaiser Permanente cancer physicians to create some cancer specific content like meditation, mindfulness, all of those things that can really help with the full aspect of health during this time.
I love that, just thinking about each one of those different aspects that you've kind of gone through that are so important and things that can really affect the well-being of people from so many different in so many different ways.
Right.
For people who want to find out more, about this work that you do and some of these things that you just mentioned, should they be somebody who wants to seek some more help, what's the best way for them to do so?
Well, so you can start with kp.org, which has a lot of our information on local services. So on our cancer webpage through kp.org, it has our support groups listed. It has some general information about our cancer center and how to get more information. And then, of course, if you're a cancer patient here with us, we are very, very available for any outreach that is needed.
Well, Doctor, thank you for all that you do. As I mentioned before, just all this work and really good things for everybody to think about, whether you're, no matter where you fit into the spectrum of somebody going through cancer. I mean, we've all been affected in some way, shape, or form, and there's always a potential for that. So knowing this and understanding ahead of time is so important. So
exactly.
Important. Well, thank you for joining us here on Fox 12 Now for this discussion and for letting us know about that. I really appreciate your time.
Thanks for having me.
And for everybody watching, we are live here out of the newsroom, and we are going to be taking a quick break. We'll come back here and continue our coverage and our conversations. We're actually going to switch gears here in a few. We're going to be talking about Mount St. Helens. It's the anniversary of that. So we have one of the scientists from the Cascades Volcano Observatory is going to join us to talk about how things have changed since 1980. Turns out, shocker, there's different ways to make those observations. So we're going to be discussing that coming up next. And of course, if there's breaking news, we'll have that for you as well. But need to take a quick break. So we'll be back here in just a few with more here on Fox 12 Now.